In this video, I'm going to show you 5 exercises for immediate back pain relief during pregnancy, or if you've had a lot of weight concentrated in your stomach area, or what we call these days during COVID, the COVID food baby. So for every pound of weight on your tummy puts 10 pounds of pressure on your low back. So that 10 pounds from pregnancy or your food baby concentrated in your abdomen puts 100 pounds of pressure on your low back. And it also causes an arch in the low back that can get painful. These exercises can be done either sitting and standing, and breathing is important. Breathing in for relaxation and then out during the contraction. If lying on your back is uncomfortable, several of these exercises can be done on a chair. So the first one is just to open up that spine, because as you know, the back is arched. So just open up the legs and bring the head down through the legs, feeling that opening up of the spine. And you could just relax here for 30 seconds or a minute. And the second one is to open up the pelvis through tilts. The first one is going to be the rocking back and forth. So bring this hip up in the air, and you're bringing the hip to the armpit, and you can even stretch over to the side, opening this side up, and then come to the other side, bringing this hip up in the air, bringing the hip to the armpit, and just leaning over to the side, opening up this area. And you can create a little bit of a rhythm back and forth while you do this. Hip up, shoulder down. Hip up, shoulder down. And just go back and forth. And this could be a little bit sensitive, and that's because you're opening up that low back. And the second one is a rocking exercise. So you're coming here, you're arching your back, and then you're tucking your pelvis in and rolling your back like this. This is how it looks from the side. Arch, and then relax back. Arch, and then relax back. And during pregnancy, people oftentimes have problems with urinary retention. So with this exercise, and you're not going to be able to see this, when you arch, you're going to breathe in. And then when you come back, you're just going to tighten those muscles as if you're trying to hold your urine. Relax, breathe in. And then squeeze as if you're trying to hold your urine. For about 10 seconds, and then continue on with that. Breathing in and breathing out, squeezing as if you're holding your urine. All of these exercises can be done on a mat as well. And even if you're in the 3rd trimester, you can lie on your back for a few minutes. It'll be okay. So the first one is to bring the pelvis. We're going to do the pelvic tilts first, bringing the pelvis up, hip to the armpit, and then relax. Come to the other side, hip to the armpit. And you could feel the low back opening up, hip to the armpit. In yoga, they call this the windshield wipers, and you're using that sacrum to just wash the mat. And you're coming back and forth. Breathe in and then breathe out. Bringing the hip to the armpit. Breathe in and breathe out, bringing the hip to the armpit. And the second one is going to be just the pelvic tilt. So you're going to be bringing your stomach in to your spine, tilting this pelvis up, and then back down to neutral. Breathe in, breathe out, tilting the pelvis. And then breathe in and breathe out, tilting the pelvis. And then this next part, once again, like with the seated, you're not going to be able to see this, but we're going to add on to, for the urinary retention, you're going to breathe in and then breathe out. And as you're bringing the tummy in, you're doing that pelvic tilt. You're also squeezing your pelvic floor, so you're holding on to your urine. And then breathe in. And then breathe out, tilting the pelvis and squeezing on as if you're holding your urine for about 10 seconds. And just keep repeating this, breathing in and breathing out, bringing the abdominal wall into the spine and tilting and squeezing as if you're holding your urine. The next exercises are going to be done on all fours. Wrists under the shoulders, knees under the hips. And you're just repeating what you did when you were lying face up. So you're going to wag the dog, bringing the pelvis to one side, bringing the hip up to the armpit, and then to the other side, bringing the hip to the armpit. Again, bringing the hip to the armpit, and then the other side, bringing the hip to the armpit. And when you start this, make sure your spine is in neutral. So you're going to probably be naturally arched like this because of the weight. Bring the pelvis into a neutral position, and then continue. Bringing the hip to the armpit, and then the other side, bringing the hip to the armpit. And this should feel really good, just opening up that low back. And breathe in, breathe out, hip to the armpit, breathe in, and then breathe out, hip to the armpit. And then we're going to be doing the pelvic tilts the same that we did lying face up. So find a neutral spine, breathing in, arching, breathing out, and just curling the back. They call this cat-cow in yoga. Breathing in, allow the back to arch, and then breathe out, bringing it all the way in to the spine. Now we're going to incorporate that urinary retention exercise into this. So now you're going to breathe in. And then as you breathe out, you're going to squeeze as if you're holding your urine for about 10 seconds. Breathe in, let everything relax, let the belly drop. And then breathe out, squeezing as if you're holding on to urine. Just strengthening that pelvic floor to prevent leakage. Breathing in. And then breathing out, squeezing that pelvic floor. And then finally, a stretch to open up the back. You're going to put your knees to either side of the mat, reach forward, and then drop back like so. And hold it. And if it's a little uncomfortable because maybe you're in your third trimester, you could even use a pillow. And then just drop back and relax the head. And then just allow yourself to relax into this pose. And come back as far as you can, tucking the pelvis and feeling that lower back opening up. And last but not least, we don't want to forget the theracane. And again, like you do with the low back massaging, you can line your low back, bring the theracane underneath, and just push up against those areas that are sensitive. That sacrum or that triangle bone is the one that can be really sensitive and tight, and you can even massage into the buttock area. And then the other side as well, right underneath that low back. And just using torque to massage these muscles and move the theracane around to work on those tender spots. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.